Hi, my name is Cindy Ip, and my topic today is So, what is Essure? Essure is a surgery-free permanent birth control method for women who are ready to stop getting pregnant. It is a natural birth control method in a way that it has no use of hormones. Most women who had chosen Essure can get back to their work or follow their daily routine the day after the procedure has been done. Essure users say that they are satisfied with their results and they are happy that they do not have to rely on and try other temporary birth control methods every other time. Essure has been proven by the FDA in 2002. It was the first method of transcervical sterilization approved for use. It costs about $2,300 on average. However, it doesn't protect the individual. Women who would consider Essure as their birth control methods are women who want to stop getting pregnant and avoid unplanned pregnancy, while some women see Essure as a replacement for many other temporary birth control methods. The Essure procedure is done at an Essure certified doctor's office. Unlike other birth control pills and birth control methods, a lady who has chosen Essure doesn't have to take medication or go over the counter at her local pharmacy. Instead, all she has to do is to schedule an appointment with an Essure certified doctor. Before the procedure, the doctor would ask his or her patients questions regarding to the readiness and confirmation for Essure, because it is a non-reversible procedure, meaning that once the procedure is done, the patient will not be able. Here is a brief description about this surgery-free birth control method for those who are serious about Essure or may consider Essure as their birth control plan in the future. It usually takes no more or less than 30 minutes. The method of use for Essure is hysteroscopic sterilization. 2 tiny coils will be inserted in both of your fallopian tube during the procedure. Before undergoing the procedure, doctors will insert a hysteroscope through your vagina and cervix into your uterus and fill in fluid to ensure that both fallopian tubes have no blockages so that those 2 coils can be inserted successfully. After 3 months that the procedure has been done, you'll have to go back to your doctor's office to do an Essure confirmation test, which the doctor will ask his or her patient to do an X-ray to observe whether the barrier is now at a safe level. This is to make sure that the placement and the attachment of the 2 coils in the fallopian tubes. Within the 3-month waiting period, however, you'll still have to take other This slide is showing how the 2 barriers in the fallopian tubes on both sides of the uterus are stopping sperms from getting through. This slide here is showing how the confirmation test is done. Doctors will insert a dye, which is shown as purple here, so that it allows him or her to assess the placement and attachment of the barriers on an X-ray slide. The successful rate for Essure is 99.80 to 99.83%, according to Essure.com. Knowing the successful rate of the procedure is important when one is concerned about pregnancy prevention. As a matter of fact, it applies for all birth control methods, especially when it comes to permanent birth control. This is because people didn't expect to get pregnant once they have a permanent birth control done and want to make sure that they wouldn't get pregnant from unprotected sex. Even the successful rate is high. However, women who are considering Essure should note that the rate also indicates a risk of pregnancy. And just because it has a considerably high successful rate Women who think Essure is a desirable permanent birth control method should always keep in mind this slide is showing some advantages and disadvantages of Essure and its positive and negative side effects. For your information, please go to these websites to find out more about Essure. Thank you for your time, and I hope this presentation will provide you another option of contraception.